Welcome to the first phase of the rehabilitation protocol. I'll give you a bit of education about this phase and also go through the goals. The first goal of this phase is to control and reduce pain and swelling. Surgery is a traumatic event that involves damage to muscles and other structures of the knee. As a normal response to this trauma, there is widespread swelling and inflammation of the knee joint. This inflammation can make it difficult and painful to move the affected knee. As such, it is essential to control and reduce the swelling and pain in the knee to enable a timely recovery and restoration of normal function. This phase involves the first 2 weeks of rehabilitation, in which the damaged structures will have the chance to heal before comprehensive rehabilitation is undertaken. If pain and swelling are not adequately controlled, there is an increased risk of further damage to the tissues and structures of the knee joint. Regular completion of the RICE principles involving icing, compression sleeve use and elevation will help with this. I would recommend lying on a couch or bed for most of the first couple of weeks. Try to have a few pillows nearby or a rolled up towel near your feet so you can prop your leg up to help elevate it. I would recommend keeping your leg in this position for most of the day to not only help with the elevation and clearing swelling, but also to regain extension in the knee. This may be particularly painful to start with, but just do what you can as it's a very beneficial position. The exercises in this phase are very light and are important for beginning to regain normal muscle function, as well as restoring the ability to straighten the knee. This is the second goal. Being able to fully straighten the knee is particularly important, and if you are unable to do so after the first 3 weeks, your surgeon may consider going in for another arthroscopic surgery. So it's important to get on top of this in the early stages. Another goal for this phase is to get at least 90 degrees of bend at the knee. This can be accomplished by regular completion of the exercises, but pain and swelling will be limiting factors, so if you can get these under control, that will help as well. A lot of the focus is around regaining control or the ability to activate muscles around the knee, particularly the quadriceps. This is because during surgery, because of the damaged tissues and the pain that occurs and the inflammation around the knee, some of the muscles don't work the way they're meant to. They sort of adapt the way they normally function, and so it's important to try and retrain these to get back to normal functioning, and these sort of exercises will help regain function and get you back doing more functional things like walking more normally. Which brings us to the last goal, which is actually normalising the walking pattern with and without use of crutches. So obviously, because you're not going to be able to move your knee fully to start with, you're going to have a bit of a strange or antalgic gait pattern, but it's important to try and normalise this as much as possible. So some good ways to do this are just to try and keep walking in a straight line, straighten your knee, particularly when you're putting weight through it, and also maintaining heel-toe walking. So that means trying to land on your heel and then walking through onto your toes. So that's a brief rundown of the goals for this phase. Look through the other tabs to find the exercises and progression criteria for the next phase.